Hello, my name is Abigail Plumer. I'm in 9th grade, and this is my project on suturing. I have really been interested in the medical field, and so when I saw that I can do a project on suturing, I jumped right on that. So this is some of the history behind suturing. Suturing has been around as far as recorded in 300 BC in ancient literature. Natural materials such as animal intestines, plant fiber, silk, and even hair was used for the first suturing materials. So this is a picture that I got, and I read some information that we don't know the first suturing situation, but it was said to be on the shoulder. They were suturing on the shoulder. The needles consist from bones, and they were used to pass through the skin of the wound. And so this is called catgut, and it is made from the intestines of a sheep or a goat. And these are a picture of some of the bones that were used. And I'm going to show you what we use now, and they look a lot different. The importance of suturing. Suturing provides a mechanical support in order to sustain the closure. So it provides this tension on the wound, and it helps the healing process. It stops the bleeding, and it ties on the blood vessels. It reduces risk of infection. If the wound is open, there is more of, this is the grossest picture I have, I promise. It provides less risk of infection, because if it is closed, then you can't get that bacteria and all that dirt in the wound. It makes the process of healing faster and sometimes less scarring, depending on the suture that you use. So this is a picture of an open wound, and then you can see it's sutured. It's closing tight, the tension is there, but sometimes whenever you have those sutures, they can get infected. If you don't have it dry and you get it all wet, that can get moisture and it locks in and it can be infected, and that is not good. The materials: absorbable sutures, and there are non-absorbable sutures. Absorbable sutures, they dissolve because they are from natural material, and they're in for about 10 to 8 weeks. Non-absorbable sutures don't dissolve naturally, and they have to be removed. So then you would just schedule a revisit with the doctor and get them cut out. The absorbable sutures are silk, catgut, polyglycolic acid, polycolic acid, and monochrol. Then the non-absorbable sutures are nylon, polyester, stainless steel, polyvinylidene fluoride, PVFDF, and polypropylene. Where suturing is used. When you think of suturing, you just straight think to surgeries. That is not always the case. Yes, it is in the hospital during surgeries. You can have it externally or internally. So that's saying you can go to the ER if you cut your hand open and get stitches, or during surgery, you can have tissue inside of you sutured. And that would be an example of an absorbable suture. The dentist, they close and stabilize wounds from oral surgery. So if you have this, an example of that would be the wisdom teeth. They would use an absorbable suture in your mouth. Veterinary suturing incisions wounds after surgeries. So like if your cat gets cut, or if they have to go in for a surgery, then they can suture that area up as well. The different types of suturing techniques. There's the instrument tie, simple interrupted suture, simple buried suture, vertical mattress, horizontal mattress, figure of 8, simple running locking, and subticular suture. Now just a little information on each of those. This is a method of closing and securing a suture with a needle driver. A needle driver is this tool right here. You take the needle, and this is what you use to do your suturing with. Many types of surgical knots are used, but most commonly used is the instrument tie. You loop it twice around the needle driver and pull straight across. Then once around the needle driver, you repeat that 3 times to make sure that it's secure. And if you don't do that 3 times, it can come undone, and then there's no point of the suture because then the tension isn't there. Simple interrupted. It's commonly used for wounds with well-approximated skin edges, but under no tension. Individual stitches, they are about 0.5 centimeters evenly apart. So you can see about 5 from here and then 5 from here. And it is a single loop and a knot. If one fails, it should still hold. This is probably, if you go into the ER and you get stitches, this is most likely what they're going to do. They're going to do the simple interrupted stitch. It can be time consuming, but if one falls out, then you don't have to worry about it all falling out. So this is the con of that one for the pro. Next, you have the simple berry suture. It is used for closing wounds from a deeper layer of the skin, the subcuticular tissue, or the dermis. So here you can see you have the epidermis, which you can see on your skin right now. It's a fatty layer. And then you have the dermis and the subcutaneous tissue right here. And then you have the muscle right here. Those are veins and arteries right here. That's the hair molecule. Oops. There we go. Sorry, I touched the screen with my sleeve. The goal for this suture is to be hidden underneath your skin so that it is not seen. It is minimal scarring, and absorbent material is usually used with this suture so that you don't have to worry about cutting it out. The vertical mattress suture. This is used for wounds with edge aversion to reduce tension on the gap. So the edge aversion is when your skin puckers out and it's like a little bump. So like it's raised, kind of like this instead of in. It is good for high tension wounds. The greater the tension, the wider your stitch will be. The suture is placed in a box-like structure right there. And then we have the horizontal mattress suture, and it is just a little bit different. It is used more often in fascia, a type of connective tissue surrounding and supporting muscle, bones, and even organs. It's often used in calloused areas like your palms or the soles of your feet. It allows a version of the edge of the wound. Next, we have the figure of 8 suture. It is used to compress tissue and control bleeding. This one is good for high tension areas and extra support. Avoid the suture on facial wounds because it can leave more of a scar. This is most commonly used to ligate or tie off bleeding blood vessels. So like if you have a bleeding artery or vein, then this is used to tighten and control that bleeding. The removal process can be difficult, so absorbable sutures material is preferred for this one. And it takes that and it like scrunches it in that area. Next, we have the simple continuous. This is another commonly seen suture. It is used mostly for clean, low-risk wounds under no tension with a flat, immobile skin surface. This is good with children because it's simple and quick, and it is just better because kids have less of a intention. So you want to start with a knot, continue to the end of the wound, and place another knot to secure. The risk is if one loop breaks, the whole stitch can unravel. So this one is not as secure and I would do the simple interrupted stitch instead. Next, we have this simple walking running suture. It's used for wounds under tension, so equal tension is distributed. It's good for controlling bleeding, like the simple continuous suture, but each stitch is locked in place. More secure and even closure, especially when tension is prevented. Each stitch is locked by passing the needle through the loop of the previous stitch before pulling. This one is very good whenever you don't have an assistant helping you to hold the skin tight so that each stitch, it locks in place and you can pull it tight and so that you can keep on doing the rest. Next, we have the subtacular running suture or continuous intradermal suture. Both are the same type of stitch, just different placements and depth. It's used primarily in cosmetic surgery, enhanced wound appearance. So that is just to like fix like your body parts, just to make you look better. It's low tension areas. It's good for pulling wounds together. It reduces tension and gapping so that it comes together, and it can be time consuming. So this is one that is not often used as much. Lastly, here are some fun facts. You can practice suturing on fruits like bananas and oranges because they have a thicker layer on the outside, so like their peel, because it's kind of like skin but more delicate and easier to tear. As I said, catgut, it's made of twisted animal intestines, usually from a sheep or a goat, and they were used around the 1600 BC as one of the first suture materials. In 1887, the first mass production sterile suture were invented by Johnson & Johnson, which it changed the medical field. Before, they didn't sterilize their materials, and that created more of a risk for infection, and it was a lot dirtier. So this was huge for the medical field. If stitches are left in too long, skin can grow over them, and then that can be like a mound on your skin. It's not pleasant. I saw pictures. After getting stitches, you might not be able to shower for 24 to 48 hours, so you can keep your stitches dry to prevent infection and faster healing. This depends on your area of your stitch, but if you get those stitches wet, you have a higher chance of infection. It's not pretty. And what I wanted to do for you today is just quickly demonstrate a quick little stitch on Chad. I named him Chad the banana. What I'm going to do also is I am going to pass this around so that you can see each stitch. Just be gentle with it because it can rip. And so what I'm going to do as you're looking at that is go through what you would do if you were having a little stitch. So you'd first have the wound right there. And then you would take your scalpel and blade. Usually you do this on a flat surface. So you'd take it and you'd make a little incision right there. See, it's open. Then you can take that and place it down. And then there's the different types of suture. There's monofilament, which is one, and then there's braided or polyfilament, which is many. And that just means the thread of the suture. I'm going to be using the silk. So I'm going to take it like so, open. This is not the most sterile technique, but it gets the job done to show you guys. And then you take your needle like so, and as you can see, the bone, it was more straight. This is more, it looks more like a fingernail clipping or maybe even a staple, which you can also get staples in the ER if you aren't getting stitches. And you can see right there, you can see your thread. And you take them like so. And you go in at a 90-degree angle, like there. And then you go at even bites, so about there. Then you pull it through. I can show you guys in just a second, but I'm going to have to put them down. And then what you can do is, this is called a tail right here. What's left is this little piece. And you would take the longer piece with the needle on the end, and you'd wrap it around twice, just like the instrument tie. And you take it and you pull straight. You don't want to cross them. You want to pull so it's straight down. And then what you do is you do that 3 more times. You do it 1, 2, and then 3. And then you get your scissors over here and you cut off the excess depending on what you're doing. If it's a continuous, then you keep on going from there and you don't cut. But if you're just doing an interrupted stitch, then this is 1 interrupted stitch right there. And then you would just continue going down until they are all, until the wound has tension and it is all fixed. And that is my suturing project. If you have any more questions, let me know. Ashley.
So, whenever you're,
It's okay. Liam?
Can you pass the banana run on Chad around?
Maybe later.
Might eat them.
Yeah, we don't want to eat them. Linus.
I was gonna say I have 2 questions, but I was gonna say, are you gonna eat them? But
I don't like bananas.
my second.
Oh yeah. Your second question?
My second question was, are you gonna wake them up? He's sleeping.
Hey, focus on what she just presented.
Ashley.
so whenever you're getting your like suturing, would you usually have like the patient, would they be asleep? Like,
They would probably get general anesthesia or local anesthesia so that it's just in that place and so that they wouldn't feel the needle going through. It just depends, because during a surgery, depending on the surgery, yeah, you'd have general anesthesia where they're asleep and they wouldn't feel it.
So if it was just like 2-inch long wounds, which suture or stitch would take the longest to like sew that up?
It depends on the depth of the wound and just the width of how wide it is of the wound, because it depends on how you would take care of that. How would you address that? So it all just depends on how it is. Ms. Becky.
Do you think, and maybe you don't know, and you can say you don't know, but do you think like liquid glue has replaced a lot of the suturing that you're doing, or is suturing got its own particular place that it serves for medical purposes?
As I said, there was different ways that you can take care of a wound on the outside, so externally. Yes, glue evasion is an idea that you can take it. It's if that wound is not as wide, and it depends on how deep it is. If it's just, it all depends on the wound. So like you can use staples for your wound to close them. That does have more of a risk of scarring. You can even do, there's these strips that you can take instead of suturing. It just all depends on the wound.
What do you think is the best kind of stitching when after you get brain cancer?
Brain cancer? I don't know. I'd love to look into that and get back to you though. Ashlyn?
so obviously you were just like presenting how you would like stitch it, but if you had like a real patient and like they had like a deep wound, would you have to like make sure that the thread or whatever that you're like going through, is it like touching other things? That way there isn't like bacteria on it before it goes into the skin.
So it does come in a little packet, and you can see there's an expiration date, so you can see like when it expires. So that is whenever the sterileness of it isn't there anymore. And so it comes in a sterile packet, and you do keep that area clean. What you want to do is you want to try and keep a sterile workspace anytime you do anything. I'm not sure if that answered it directly, but I can talk to you after. Marley.
So could a butterfly band-aid work as stitches?
That is another way.
Remember I had like a really deep cut on my hand. My mom used butterfly.
hmm Yeah, that is another way. Colton.
What one will like hold like the strongest?
Hold the strongest?
Mm-hmm.
I'm not sure. I'd have to get back. Valerie.
So if there was like muscle deep wounds, would they also use sutures on that?
Yeah, so there's layering that they can do. So they would do that area, they would suture that area, and then they'd go above into the different area. As I showed you the skin, there was the muscle, there was the epidermis, dermis, the subcutaneous tissue, and then the muscle. And so they would get the muscle sutured first, and then they'd layer and they'd go up to the dermis, and then they'd close that off to create tension. Ariana.
Last question.
Out of all like the stitches, which one do you think like would it really be the best to use?
The simple continuous. Just because if one of those, if you snag it on something, or if you it actually accidentally tears, then that whole suture can come undone, and then it wouldn't be good because then there's no tension to hold it, and the healing wouldn't be there.
Nice job, Abigail.
Okay.